today I wanted to talk to you a little bit about rib pain. So this is Mary Bengoa coming to you from Bengoa Physical Therapy, and I do a lot of work with people who have problems with their ribs. And honestly, I hear all the time, I didn't know I had ribs there. I didn't have any idea that that could be a rib that's causing my problem. And so I want to share with you for a minute a little bit about ribs. So this is a skeletal model. And oftentimes I have people who have their first rib come out of alignment. And so when I push on that spot in their neck and they feel like it hurts a lot and I tell them it's from a rib, they almost can't believe me. So I just want to point out to you a little bit about what the rib looks like. So here's our rib cage, and we have 12 ribs. We have here, this is your clavicle, or better known as your collarbone, and then your first rib runs right underneath that and attaches here to the front of your chest, called your sternum here. And these ribs in the back attach to our spine. So you can see how this little side joint off of the vertebra and the rib come in contact with one another. And so that's where your ribs connect in the back. And so it's actually not uncommon for people to end up having these ribs shift a little bit. So when we say your rib is out, it doesn't mean that that is like fully dislocated or anything. There are some very small joints here where the ribs sit, and it's more like the ribs should sit against the joint like so, and when they're out they can slide forward or back on one another like that, rather than staying touching in a very level way. Even that little bit of movement can create a lot of pain. So there's a lot of nerve endings where our joints attach to each other, where bones attach to each other in the joint. And oftentimes with rib pain, you'll have pain with a deep breath, pain with a cough or a sneeze. A lot of times people have pain with trying to lay down or trying to get back up. And so it's truly a very common issue, and a lot of times people don't realize where it's actually coming from. And so I actually didn't learn about correcting rib alignment and addressing that until I was about 4 years into my career and went to a class, and everything started making sense. And so it's become my mission to pay extra attention to the ribs, and I've used it a ton in my years of practice. So I've been doing this for 22 years now, and I've corrected a lot of ribs. There's multiple techniques that I can use to help you get your rib back in. And a lot of times part of the problem is muscular issue around the ribs. So here in the front of our neck, sometimes we have a lot of tension, whether we hike our shoulders up like that, whether we stay in a position and we're looking down to read a lot, or doing a task at work where we're looking down and turning our head a lot, that develops tightness into our neck muscles. And when those muscles get too tight, eventually something has to give. And so a lot of times that upper rib becomes elevated because these muscles get so tight. And so it's not always an easy fix. If you have that issue, we need to correct the alignment, and I use some muscle energy techniques to do that. And then we also need to address all the muscle imbalance around it. So if it's a rib out in your upper ribs, then oftentimes we need to stretch the front of our neck and the front of our shoulder and chest area. We do some trigger point releases, some massage, that kind of work in that area. And then we also need to strengthen the muscles on the back area to keep some of the pressure off of this spot. So that's something that can be done to help you so that you don't keep having that issue with the rib going out and you being in a lot of pain. You can also have pain down in your lower ribs or in your middle ribs. And so what I do is I actually put my fingers on your ribs and check to see if they look level or not. And then when I find something that doesn't look level, then I use my techniques to correct that. And then from that point on, we do some massage to release the muscle tension around it. I typically do a lot of joint mobilization here in your thoracic spine or your middle back. Sometimes it's because this middle back doesn't move enough. It becomes what we call hypomobile, or too stiff, and it's not doing all the movements that it needs to do. And so if this part of your back can't move, then your ribs sometimes shift out of place, trying to allow enough movement for you to do the function that you're trying to do. And so we work to make sure and restore mobility here in your back. We build strength around the rib cage, and we stretch out muscles that are too tight. So that's something that can be taken care of. You just need to come get help so that it doesn't end up staying out for prolonged periods of time, because once your ribs have been out for a while, the muscles around the ribs get used to being that position, and that becomes kind of their new home. And then it takes longer for us to get everything back in balance and for your body to want to stay in the right place. I also find that I do see a lot of rib alignment problems with my athletes. So my football players who get hit in the back or hit from the side, a lot of times that will actually traumatically put the rib out of place. Sometimes car wrecks will do it. Sometimes it's a bending and lifting type of activity. So there's lots of different things that can happen to make those ribs go out, but it also can happen just from repetitive postural things, muscle imbalances and weaknesses. And so there's a lot of work that can be done to help fix it. So please don't live with rib pain and be miserable. We have some answers for you, so give us a call if you need help.